We're back. This is the Now Morning Show. Raucus is in for Carrie, and I'm Lisa with you all the way up until 8 o'clock Eastern Standard Time. And the weekend brought with it a number of issues with regard to COVID-19. We've crossed 1,000 cases, guys, active cases, that is. And it's now the law that persons are required to wear a mask in public places. Here to weigh in on this is Dr. Erica Wheeler, WHO PAHO Country Representative for Trinidad and Tobago and the Dutch Kingdom Islands, and Dr. Marcus Espinal, Director of the Department of Communicable Diseases and Environmental Detriments of Health from PAHO headquarters, Dr. Marcus Espinal. Dr. Wheeler, good morning. Dr. Espinal, good morning.
Good morning, Lisa. Great to see you as usual.
As usual. Dr. Wheeler, I'll start with you. It's now the law, persons have to wear masks in public places and so on. First of all, how important is wearing a mask to curbing this pandemic, saving lives? There's still those who claim otherwise.
Okay, so that's a great question, Lisa. And wearing a mask is important, but I want to say that wearing a mask is part of a package of public health measures. So what the government has put out and what WHO and PAHO are recommending, that in addition to your hand washing, sneezing into the crook of your hand or using a tissue, we are saying that wearing a mask, one that covers completely the mouth and the nose, and of course it goes under your chin, offers a barrier between you and the environment. Mm-hmm. We don't have any exact percentage or degree to which this cloth mask protects us, but what we do know is that it reduces or it prevents the emission of droplets to other persons. And remember that there is a distance that also must be kept while wearing the mask. So yes, it is a critical part of our armor. Yes. I think the last time I told you, it's like we're fighting a battle. So it is a critical part of our armor.
And I do remember when I was doing some research that during the pandemic, the Spanish flu, that it is alleged that the wearing of the mask is what made a big difference, a significant difference in turning around the pandemic in 1918, I believe it was.
Yes, and also persons staying indoors, the persons who were wearing masks, and the same things we're doing now, the stay-at-home policy, the reducing the number of people who are circulating in the population. Yeah. They certainly did that back at the time of the Spanish flu, for sure.
All right, so I want to take that in another direction now with Dr. Espinal, Dr. Marcus Espinal. Trinidad and Tobago now has over 1,000 active cases. What's the outlook given the growth over the past few weeks? And can we revert to cluster or sporadic spread? Are there countries in the PAHO region we can look to that have been able to do this?
Good morning, thank you. Definitely the country can reverse, yes, if the measures and action and the package that Dr. Wheeler just mentioned, it's implemented. But not only implemented by the national authorities, but also by the population. We need to do all our part. This is not a responsibility only of government or one political party or two or three. It's all citizens' responsibilities, because if you don't comply, then we cannot, implement social distance. Yeah. Education is important, and that is important. So there are other countries in Latin America that, and the Caribbean, we can look at. For instance, I have noticed that Trinidad and Tobago still is not testing as it should, in our view. Mm-hmm. If you look at Chile, for instance, has a tremendous, important testing program. If you compare Trinidad and Tobago to other countries of the same population, for instance, like Mauritius, let's say. Yes. Mauritius has done more than 200,000 cases. Trinidad and Tobago has done about 24, 27, 25,000 tests. So it is important to increase the testing because otherwise we will not know how the magnitude of the problem is. Mm-hmm. Now, Chile is an example to look at it. The other example to look at is, for instance, a small country, Costa Rica. They created the mobile teams to ensure the people who are auto-isolated are followed properly, to make sure they receive their medicines, they receive food, and they are taken care by a family or relative. And this is because you don't have to hospitalize everyone. It is important that there is best practices, and PAHO is ready to assist the countries, as I'm sure our office in Trinidad and Tobago, led by Dr. Willett, is doing with the national authorities.
As a matter of fact, just yesterday, the ministry announced that PAHO and Trinidad and Tobago are now partnering with regard to the antigens. Dr. Wheeler, does this assist in terms of increasing the testing capabilities, the testing capacity? How does this impact, particularly in what Dr. Espinal was just saying?
Yes, so thanks again, Lisa. Definitely it will make a big difference, because what PAHO is assisting the country to do is to decentralize the testing, to make it easier for persons to go to the primary care level, meaning to their clinics, and they can be tested there. So this is going to make a great difference. We call it a game changer, these antigen tests, because the turnaround time is also going to be very, very quick. They're two different types of machines, same purpose, but between 15 and 30 minutes, you can have a test done. So this will make a really big difference in being able to ramp up the testing now, not just in the district hospitals and in Couva and Cora, but also in the clinics. So that's really important.
All right, Dr. Wheeler, our final question to you. Let's take a look at lives versus livelihood. You know, the Prime Minister has spoken about having to make that balance with regard to saving lives and saving livelihoods as well. You know, that's a tough one. And I want both you and Dr. Espinal, from his experience in the region, to weigh in on that. You know, I know WHO has been saying that they don't encourage the complete lockdown as we saw earlier in the pandemic. How do we navigate this space and maintain lives and livelihood? Dr. Wheeler first, and then Dr. Espinal.
Thank you, Lisa. So every country is different, but the principle remains the same. In the sense that, first of all, we shouldn't talk about, I know you haven't said it, but I don't want it to be in the minds of the population that it's versus. It's not livelihoods versus lives. The two must work together. We have to have a balance. And it really depends very much on the epidemiological status of the disease in the country. So now we have community spread. So we have to look at putting those measures in place, as Dr. Espinal was just talking about, to see how we can flatten the proverbial curve, okay? Mm-hmm. So it is about, if there are hotspots where we know, for example, from the evidence coming in from contact tracing, where there are particular problems, we need to address those hotspots. But we need to continue with the public health measures. It doesn't mean that we have to shut the whole country down every time, but we have to follow the science. We have to look at the epidemiological status of the country before we take an action. And we have to look at the capacity of the government also to respond by testing and also to support the population, because no government has a bottomless pit of money to address it. So the two must go hand in hand.
Yes. Let me take another angle here in support of this. Trinidad and Tobago doesn't have the type of cities that in Latin America are experiencing a major issue with pandemic, like very populous cities like Mexico City, like Rio de Janeiro, surrounded by huge belts of poverty. So Trinidad and Tobago has tremendous opportunities to flatten this curve and to make sure the virus is under control. We don't have the answer yet to all the questions related to this virus. We don't even have 1 year calendar. So we need to learn how to live with this virus. A new normalcy is not going to come immediately until we have a vaccine that is properly integrated into the immunization program and everyone has access. So people has to be patient. But social distance can do the trick. Hand washing can do the trick, and face mask can do the tricks. Non-pharmaceutical measures are the way to go, because we still don't have medicines that are cure against this virus. So let's be patient. Let's listen to the education the authorities are providing. Let's not listen to fake news. And on the contrary, we have proper websites, we're very reliable, the PAHO, and the Ministry of Health. So make sure that we all comply, because there are other cities and other countries that are seeing thousands of cases. Trinidad and Tobago still have an opportunity if the measures are implemented and complied by the population.
Thank you so much. What a wonderful way to bring closure to this interview, a very optimistic note as well. Thank you very much, Dr. Erica Wheeler, WHO PAHO Country Representative for Trinidad and Tobago and the Dutch Kingdom Islands, and Dr. Marcos Espinal, Director of the Department of Communicable Diseases and Environmental Detriments of Health, PAHO Headquarters. We have a video now that tells you how to wear your mask, courtesy of the WHO. Let's check it out. We'll be back after this.
Hello, today I'd like to talk to you about how to wear a non-medical mask, also known as fabric mask. Fabric masks can be used by the general public in areas where there are many people infected with COVID-19 in the community, and physical distancing of at least 1 meter cannot be achieved. There are a wide variety of fabric masks that can be handmade or purchased in a store. They act as a barrier so that you can protect those around you. They should ideally be made of 3 layers of fabric. The outer layer should be a water-resistant fabric. The inner layer should be water absorbent, and the mid layer acts as a filter. First, clean your hands with alcohol-based hand rub or soap and water. Pick up your clean mask and inspect it. If it is damaged or dirty, do not wear it. Place the mask on your face, covering your nose, mouth, and chin, making sure there are no gaps between your face and the mask. Do not touch the mask while wearing it to avoid contamination. If you accidentally do, clean your hands. Before touching the mask, clean your hands with alcohol-based hand rub or soap and water. As you remove the mask, lean forward slightly and remove the loops from behind the ears without touching the front of the mask. And don't forget, wash your hands after taking off the mask. Make sure that you have your own mask and do not share it with anyone. If your fabric mask is not soiled or wet and you need to reuse it, you can store it in a clean plastic resealable bag such as this one. However, if it is dirty, do not use it. Wash it with soap and water, preferably at high temperatures after each day of use. Remember, a mask alone cannot protect you from COVID-19. It must be combined with protective measures, including maintaining at least 1 meter distance from others and washing your hands frequently. Stay safe and help prevent the spread of COVID-19.